evening, everyone. Welcome to another episode of the Instagram live series for Self Care Awareness Month. This is episode 4, and we are going to discuss about self care for the patients in post-operative care. Just waiting for people to join in. So, today joining us is Dr. Rathi. He's a well-known psychiatrist. He's also an influencer on Instagram. He has done great work and helped a lot of people. We are very grateful to have him on board today. So, over the years, I've seen many people in my family and outside undergo surgery, and whenever I see people in the ICU, it is always very distressing to see how much pain every patient goes through after surgery. Recovery is a very crucial part of any treatment, and I believe that mental health, mental well-being is very important aspect of recovery. As the people recover from the incident, it is important that they also practice some self-care activities which help them in feeling better from what they are currently going through. I'm just waiting for Dr. Rathi to join in, and then we'll start the conversation. During the session, if you have any questions, please put them down in the comment section and I shall take them up. Hello to all of you who are joining in. We will start shortly. So let me know if I am audible, visible. Hello everyone. Furthermore, we are also going to discuss about why is self-care necessary for these patients. What activities can they do, because post-surgery you are in a lot of critical care. Sometimes a lot of movement, or most of the times a lot of movement is not allowed. So what are the things that we can do? We'll hear it from a mental health professional who is a psychiatrist. We'll also discuss the importance of self-care in these patients. A few general questions that we'll ask Sir about the common psychological problems that arise in these patients. Hello Anmol. Hello Akshay. Thank you for joining in. The topic today is self-care for patients in the post-operative care. I think there is some glitch and people are not able to join in. I have sent an invitation. Let's just wait for people to join in. Hello, hello, people. Thank you for joining in. Just hold on. Sir, I have accepted your invite. It usually takes a minute or two for you to be visible on the live. Okay, I can see that you have joined. Sir, I have accepted your invite. I'm not sure why you can't join. Good evening, sir.
Hi, good evening, Chaitanyaa. Can you see me?
Yes, I can see you and hear you. How are you, sir?
I'm great, fantastic. How are you? How was your day?
I'm good too. It was good. Thank you for joining. I was just talking about the topic which we are going to discuss today, that is self care in the patients who are in the post operative care. So,
Yeah,
before I start with my questions, would you like to say something?
I think it's a really valid topic because what I have seen is a lot of times we go live and we talk about anxiety, depression, schizophrenia, mental health, self-care, sleep, all of these things. But there are a lot of psychological issues that arise with regular health conditions also, and surgery being one of them, because a lot of times surgery itself is such a major issue that people don't pay much attention to the psychological issues that might arise around it, or they may be very occupied to even think about कि इसको कैसा feel हो रहा है. So I think it's very valid topic that you have taken up.
Thank you so much, sir. So, I would like to start with the question that you sent me for a general start. That is, what are the common psychological problems that arise due to surgery?
Right. So before I answer that question, let me take you through this whole process of when a surgery happens, right? Generally, surgical conditions are gynecological, general surgical conditions, orthopedic, ophthalm, ENT. These are usual surgical branches. And also there are places like cancer or gangrene, diabetic foot, where we will have to go through a surgical situation or a surgery. So before we reach up to the surgery, what happens is the person comes to know what their diagnosis is. And when they come to know what the diagnosis is, the knowing the diagnosis itself leads to a lot of anxiety or adjustment issues because it is a change. If somebody comes and tells me that, okay, you went through an accident and we might have to amputate your leg, then the first thing that comes to my mind is it's a loss, right? That something is going to happen. I'm going to lose my leg. Or somebody says you have to go through an appendectomy, a very regular surgery. But what happens is a person who's living a normal life, when there's a thought ki, even if we talk about our phone, mobile phones, if
Correct.
there's a problem in my phone and I have to give it for repairing to somebody, तो मैं चार बार सोचूंगा कि यार वो कुछ पार्ट निकाल तो नहीं लेगा, वो कुछ कर तो नहीं देगा, बाद में फोन ठीक से तो चलेगा, कुछ होगा तो नहीं. So here we are giving our body to somebody else to operate on it, to take care of it, right? Obviously, the doctors would take utmost care of it, but the person who's going to go through that whole process would feel completely anxious, would feel very fearful. कि what is going to happen because there's a complete sense of uncertainty. So that can bring a lot of emotional problems, uh, because no matter how good support system you have to go through those emotions. That can also bring a lot of, sleep disturbances or anxiety or feeling sad, feeling uncertain, at times crying. ये सब चीजें होती है. Now जब ये सब चीजें हो जाती है, the person reaches up to surgery and surgery करना जरूरी है, सर्जरी होनी ही है, सर्जरी आपने करवा ली. Post-operative time is a very crucial time because a lot of times they say that a best surgeon is the one who can take care of the post-op very well. क्योंकि
Correct.
post-op में बॉडी कैसे रिस्पॉन्ड करती है आपकी सर्जरी को, ये आप नहीं बता सकते. And every surgery is a stressful period. So whenever there is stress, there's a release of cortisol, there is change in the hormone levels in the body. The whole body is in the stress response. At that time, the body is working differently than the usual relaxed person.
Correct.
So body कैसे respond करेगी, healing कैसे होगा उनका, या फिर if there is something like an amputation or removal of a part, so what would be the quality of life after that? These are very important questions which the patient is asking his own self. क्या होगा, कैसे होगा, somebody just goes through something as simple as angioplasty. Not simple really, but आज की टाइम में एंजियोप्लास्टिक बहुत ही कॉमन सर्जरी हो गई है. आपको हार्ट में ब्लॉक डिटेक्ट हुआ, आपने एंजियोग्राफी करवाया, आपको समझ में आया ब्लॉक है, आपने प्लास्टिक करके उसको निकाल दिया. फॉर मी टू से दैट ओके दिस एंजियोप्लास्टी इज अ वेरी रेगुलर थिंग, करवा लीजिए इजी. लेकिन जिसको करवाना है उसको तो ये लगेगा ना कि यार मेरा हार्ट में ना प्रॉब्लम हो गया. अब एक बार प्रॉब्लम हुआ है तो दूसरी बार भी हो सकता है, तीसरी बार भी हो सकता है. So from there onwards, there are a lot of emotions that surface, a lot of thoughts that surface, a lot of anxiety, uncertainty that comes up. Post-operative time में एंग्जाइटी बहुत कॉमन है. A lot of patients go through depression, वो बहुत कॉमन है. क्योंकि सर्जरी सिर्फ बॉडी की नहीं हो रही है, मतलब सर्जरी एक सिर्फ बॉडीली प्रोसेस नहीं है. There are financial, monetary involvements that they have to take care of. There are social responsibilities जो सब है आपके, आपको वहां से ब्रेक लेके सर्जरी के लिए आना पड़ेगा. एंड पोस्ट ऑप पीरियड में till you recover, you can't go back to those things. So I've seen a lot of patients when I worked in government setup. I've seen a lot of patients that first thing they're not able to pay for the surgery. So that financial stress is huge thing. And then once the surgery happens, you have to stay till you recover completely. And recovery के बाद भी आप directly काम पे नहीं जा सकते. After your discharge from ICU, you will move to the ward. From general ward, you will go to home. You're supposed to rest at home also for a few weeks or months at times. Then come back for follow-ups, and then once you start getting even better, then you go. तो इतने सब ड्यूरेशन का, if the person is the sole earning member of the family, so there's a lot of financial loss that they might be going through. सो ये सारी चीजें भी सर्जरी के टाइम पे दिमाग में चलती हैं. सो एक चीज जो हम बहुत कॉमनली बोलते हैं कि एडजस्ट करने में थोड़ा प्रॉब्लम जाता है. एंड ये जो प्रॉब्लम्स है ये इमोशनल हो सकते हैं, कॉग्निटिव हो सकते हैं, बिहेवियरल हो सकते हैं. कई बार चिड़चिड़ापन होने लग जाता है, कई बार मन नहीं होता है किसी से बात करने का, स्लीप साइकिल डिस्टर्ब हो जाती है. पोस्ट ऑप आपको बहुत सारी दवाइयां भी लेनी पड़ती है कई बार टू मेक श्योर दैट एवरीथिंग हील्स वेल. सो दैट ऑल्सो एड्स अ लॉट ऑफ स्ट्रेस कि अब इतनी दवाइयां लेनी पड़ेगी, कब तक लेनी पड़ेगी, कुछ मिस हो गया तो क्या हो जाएगा. So anxiety, depression, these adjustment issues, sleep disturbances, irritation, uncertainty, and other factors getting affected. ये सब चीजें पोस्ट ऑपरेटिवली बहुत ज्यादा पॉपअप होती है या बहुत ज्यादा बार एड्रेस करनी पड़ती है.
Correct, sir. And the idea for this topic, I could very well relate because somebody in my family very recently underwent a bypass surgery, and I spent 20 days outside the ICU. And whenever I went inside the ICU, I could see the distress on all the patients' face. And I was like, there was no psychiatry department at that particular place. And I was like, who would take care of their well being? So that is where this idea of discussing this topic came up so that the caregivers could understand the importance of self care, of mental well being for all the patients in the post operative care. So,
In
moving ahead.
psychological terms, it is called as sublimation. कि आपके अपने एक्सपीरियंस से को आपने इस तरह से ढाला है, इस तरह से फेस किया है कि it is going to benefit a lot of other people also. I think that's commendable, really nice of you.
Thank you So much, sir. So, coming to self care, why is self care necessary, and what are some activities that these patients can do? Because their movement is very restricted.
So what I would say is care is necessary. Care in all terms with respect to diet, with respect to sleep, with respect to physiotherapy or any other kind of activities that they are advised based on surgery. Care is necessary. But that one person who is on the bed and other people around them, हर बार ये नहीं possible कि other people should be able to take care of them. Though they try their best, but they, because they are capable, they would have to go out to their jobs, they'll have to do their own works. And that is why it is important to at times go into that mode of taking responsibility for your own self. कई बार ये होता है ना कि post surgery patients start feeling that something is wrong with me. I am a patient. You know, the patient role. We generally say that when somebody takes a patient role ये ऐसी एक चीज है जिसमें बहुत ज्यादा sometimes there is shame, sometimes there is guilt, sometimes there is low self esteem. कि आपको ऐसा लगने लग जाता है कि कुछ तो भी गलत है मेरे साथ में, दैट इज वाई मेरी वजह से ये लोग भी यहाँ अटके पड़े हैं और मुझे ऐसा हुआ है इसलिए सबको तकलीफ हो रही है मेरे वजह से. दिस इज जनरल इंडियन माइंडसेट दैट पीपल थिंक. So this is kind of a victim mentality that no, something is wrong with me and I am the victim here. But I think we need to move out from that into a warrior mentality or into at least taking charge, taking care of our own self, saying कि ठीक है, I would follow a protocol for me to recover completely. I would, take care of my sleep, take care of my medications, जो भी दवाइयाँ मुझे लेनी है. We generally advise, and in all the good hospitals I have seen that there is pre-op, post-op counseling. जिस काउंसलिंग की बहुत जरूरत होती है पेशेंट को, बिकॉज it is a phase which only the patient can understand. It is a emotional disturbance which only the patient has to go through. So it is important to have that conversation with them so that they can express what they are feeling. And at times that counseling, that therapy to recover from all that post-op stress is also important. So Davaiya, exercise, diet, and taking care of your mental health. I think these are some of the important ways that you can actually take care of yourself.
Thank you so much for explaining that, sir. Lastly, I would like to share it with my audience that you really enjoy poetry, right? So, if in a few lines, could you express the importance of self care for these patients in form of a poem?
I'd say one of my share that, as I said, you have to move out from that victim mode
Yes.
or feeling sad for yourself, sorry for yourself mode to taking charge. And once that starts happening, everybody that comes to see you would be able to see a different version. They would have a different example in front of them of how to cope up with such incidents or such phase of your life. So एक शेर मैंने लिखा था कि दुनिया के लिए मिसाल रखो, अच्छे लोग संभाल रखो, और इसमें अच्छे लोगों में आप खुद भी आते हो. दुनिया के लिए मिसाल रखो, अच्छे लोग संभाल रखो, दुनिया को जरूरत है अच्छाई की. सर्जरी के पहले, सर्जरी के बाद में, या फिर सर्जरी ना भी हो रही हो तो भी दुनिया को जरूरत है अच्छाई की. सुनो, तुम अपना ख्याल रखो.
That's beautiful, sir. Thank you so much.
थैंक यू सो मच.
Um, so those were questions from my end. If audience have any question, they can put it in the chat box. Your winding up thoughts, conclusion for the life. Any message for the audience?
One thing that I would say is, now that we have discussed this whole topic, I think it is important for everybody that if you have, like you went through an experience, I have my own share of experiences where there were my family members who were in hospital and I had to be there. No matter whether you are a doctor, whether you are a patient, whether you are an engineer, whether you are doing anything else, but hospital like environment ही ऐसा है जहाँ पे बहुत stress आता है. So
Right.
as a caregiver also, we need to take care of our mental health to keep
Yes.
so that we are able to take care of others. And we are also, as a support system, we should try to create an environment which is very conducive for the patient to express themselves. फिजिकल एस्पेक्ट्स के अलावा इमोशनल एस्पेक्ट्स पे भी डिस्कशन होना चाहिए, बात होनी चाहिए कि आपको क्या लग रहा है, व्हाट वुड मेक यू फील गुड, व्हाट कैन आई डू फॉर यू, थिंग्स लाइक दिस. बिकॉज पेशेंट अपने he would go through his emotions. There's no way that you can take that out. But when there is a supportive environment, then it becomes easier for the patient also to heal through this whole process and to come out on a better side. And a way to provide that supportive environment is also to take care of your own self, because you cannot give from an empty cup. So you have to take care of yourself, and that way you would be able to help somebody else also take care of themselves.
Yes. Thank you so much, sir, for this session. I was looking forward to this conversation. Thank you so much for joining in and looking forward to more such conversations. Thank you so much.
Thank you so much for inviting me. I really enjoyed it. And I hope you come up with more such off-road topics, more such unique topics. Not always through personal experiences, but definitely come up with such good topics so that we can discuss these things.
Yes,
Take care.
sir. Thank you so much. Take care.
Yeah.
Good
Bye.
evening, everyone. Thank you for joining.